peripheral arterial pulses and jugular venous pressure. We'll start by talking about the peripheral arterial pulses. Before we begin, it is important to know where each pulse is located. This diagram shows where all the arterial pulses can be felt throughout the body. There are 4 things that we look out for when we examine the arterial pulses. They are the rate, the rhythm, the volume, and the character. The rate and rhythm is usually assessed at smaller arteries such as radial artery, and the volume and character is examined in pulses of larger arteries such as brachial, carotid, or femoral arteries. The pulse rate is the number of pulses occurring at a minute time. Normally, the resting heart rate lies between 59 to 95 beats per minute. Heart rates faster than 100 beats per minute is known as tachycardia. Rates lower than 60 beats per minute is known as bradycardia. The rhythm of pulse is the pattern or regularity of the pulses. It can be regular or irregular. Pulse volume is the perceived degree of pulsation. It can be increased in several physiological and pathological conditions. The character of the pulse is an impression of the pulse waveform or shape. There are several distinctive characters of the pulse we see in several conditions, such as slow rising pulse, collapsing pulse, pulsus paradoxus, radio-radial delay, and radio-femoral delay. Now let's see how we examine the peripheral pulses. Before starting the examination, you must perform proper hand hygiene, introduce yourself, and explain to the patient what you are about to do and gain their consent. You must use both the index as well as the middle finger to palpate each pulse. Assess the rate and rhythm through the radial pulse. Next, check for radio-radial delay. Next, assess the brachial pulse. The volume and the character can be assessed here. When examining the carotid pulses, it is important to avoid checking for both pulses at once, as it can cause reduced cerebral blood flow. Palpate the femoral pulse at the mid-inguinal point, which is located at the midpoint between anterior superior iliac spine and the symphysis pubis. Next, check for radiofemoral delay. Next, palpate the popliteal pulse located in the inferior region of the popliteal fossa. Finally, palpate the posterior tibial and the dorsalis pedis pulses. Palpate pulses of both sides. Once finished, thank the patient. Next, we will talk about measuring the jugular venous pressure. Jugular venous pressure, or JVP, reflects the right arterial pressure, which is normally less than 7 millimeters of mercury, or 9 centimeters of water. This is the normal JVP waveform. There are 3 waves and 2 descents. A wave represents the atrial systole, C wave represents the closure of the tricuspid valve, and the V wave represents the peak pressure of the right atrium immediately prior to the opening of tricuspid valve. The AX descent represents the reduction of pressure due to the downward displacement of the tricuspid ring during systole. The VY descent represents the descent at the commencement of ventricular filling. There are several conditions where there can be abnormalities in this waveform or elevation of JVP. When measuring JVP, we have to position the patient supine, reclined at 45 degrees. The head should be resting on a pillow and slightly turned to the left. Approach the patient from the right side and look across their neck. The JVP should be visible. If there is difficulty in seeing, use a torch and illuminate the neck in an oblique direction. You should find the JVP behind the sternocleidomastoid muscle. You can confirm whether it is the JVP by applying a slight pressure on the abdomen, which increases the pulsation. When measuring the JVP, we measure the hydrostatic pressure using the height from the upper limit of the pulsation to the right atrium. As the height from the sternal angle to the right atrium cannot be measured, We only measure the height from the sternal angle and add 5 centimeters to our measurement, as we can assume the vertical height between the sternal angle and the right atrium is as such at a 45-degree recline. The arterial pulse can also be mistaken for JVP. To confirm this, we can palpate the visible pulsation. The JVP is not usually palpable, and when we apply pressure to the abdomen, the pulsation should increase if it is the JVP. That brings us to the end of this video. Thank you for watching.